Hey guys, let's talk about female cancers and kind of go into some more in depth into some of these specific cancers and understand them. Now, if you're an adult, you should not be watching this because this is just for complex students. And I know it's labeled that way, but I know sometimes y'all get confused and overwhelmed with school. So I'm going to just give another reminder at the beginning. This is for complex students in their last semester. So let's start by talking about breast cancer. So breast cancer is one of the most common cancers, and some risk factors for breast cancer are going to be being over age 50, alcohol use, which is constituted as more than one drink per day, and or long-term heavy smoking. If you had an early period or late menopause, and you're going to see that as a really common risk factor for a lot of these cancers we're going to talk about, and that's because the longer that you have that exposure to certain hormones, sometimes it can put you at higher risk for some of these cancers. Having a family history, being female, having your first pregnancy after age 30, no children or no breastfeeding, genetics, and then obesity and weight gain or physical inactivity, especially after menopause. So there's two types, or I mean, there's multiple types of cancer, but two of the main types is, a tumor or an invasive breast cancer. This is the what you when you think of breast cancer, this is probably what you're thinking of. There's a lump or a thickening of the breast. Usually, a patient will find it in self-exam, on a mammogram, or maybe in their doctor might find it when they're doing their yearly physical. But they can also have nipple changes like discharge or retraction as well as a symptom. There's also inflammatory breast cancer, and this one has a very, very poor prognosis. It's very fast growing. The breast has kind of what's called a peau d'orange. If you are like adore the français, that effectively the breast will look red. It's going to feel warm, and it's going to have like thick, it's literally like the tissue is inflamed. And so usually when that with that cancer, it's incredibly rapid. And so if not caught early, it has a very poor prognosis. So, how do we diagnose and monitor breast cancer? Breast cancer has a high chance of reoccurrence and spreading, to other areas. So, I need to, be monitoring, of course, for metastasis elsewhere. Bone, lung, brain, and liver are common metastasis sites. So, my mother actually passed away from breast cancer when I was young, and for her, it started in her breast, obviously, and eventually spread to her bone and then spread to her brain. And so some of those manifestations, she started having bone pain, she started having changes in mental status, confusion, inappropriate emotions, things like that. You're going to be looking for changes in those organs that are going to be showing that maybe there's decreased functioning or a problem. Diagnostic test that we're going to do a biopsy, of course, of that breast tissue, or if there's any sort of metastasis somewhere else, we're going to look for it there. It's very common in breast cancer for it to spread to the lymph nodes. So, also looking at those lymph nodes to see if there is metastasis, and then hormonal labs to see what their hormone levels are, because that can have a factor as well. Overall treatment and management for this, usually there's surgery, and they could have do a lumpectomy, which is where they just remove the tumor itself and spare a lot of the breast tissue. They can do a mastectomy, which is taking all of the breast tissue. And something to keep in mind that with both of these procedures, there's high risk for lymphedema. And so there's no blood pressures or sticks allowed on the side. And I'll talk about lymphedema precautions a little later on a different slide. There's also reconstruction surgery. So after, patients, if they do get a mastectomy or a lumpectomy or need any reconstructive surgery because their breast tissue has changed in shape or size, or they don't have breast tissue, a lot of times there's reconstructive surgery after, like breast implants and things like that as well. Chemoradiation is very common for this type of cancer. They also have targeted hormone or immunotherapy available as well. So as a whole, I want to support a very positive body image. Female cancers are very hard, especially breast cancer on a woman, because a lot of times women are defined by, their physical female features like their breast. So we want to definitely support a positive body image and support them in um, what do you call it, as they are going through their treatment, to let them, be able to express themselves and what they're feeling in relation to their cancer. We also want to prevent complications and manage symptoms. So the lymphedema, which I'll talk about, pain management, and chemoradiation side effects, like I talked about in the other PowerPoint. So overall teaching health promotion. So like for myself, I have the option of getting the BRCA gene testing since my mom had breast cancer at an early age. Multiple of my family got tested after my mom passed and found, that they did not have that gene. It is expensive and a lot of insurance won't cover it unless like pretty much for me, what they said is that like both my mom and my sister would have to pass away before they would cover it. And that's not something that's something that they, oh God, I hope doesn't happen. But you have to have two like really close relatives. Otherwise, it's a very expensive genetic testing is very expensive. So it's a personal choice. Some people like to get it so that they know, hey, I'm really high risk, and maybe I need to get prophylactic surgery to have, some of my, organs or female, body parts removed, like my breast tissue or my uterus or my ovaries removed. If that's I'm going to be high risk for that. Where other people, they find that that can be very terrifying. So just supporting a patient if they're interested in that, or if they think that that's not really their best option. And then managing risk factors, all those risk factors we talked, a lot of those are lifestyle risk factors. And so, kind of the smoking, the drinking, managing their weight and their health, and when they're choosing to have children or other ways to help out that patient to kind of prevent cancer. After going to surgery and having whether a lumpectomy or a mastectomy, we want to teach them how to manage their drains at home because most likely they're going to go home with some surgical drains like a JP drain. They're going to need to know arm and shoulder exercises. Most of the time with these surgeries, they not only remove breast tissue, but they also remove lymph nodes. So they're going to sometimes be at risk for not getting proper drainage to those lymph node sites. So teaching them arm and shoulder exercises can be very helpful. Using warm water and analgesia or pain medicines prior to exercise can definitely help. And they should report any inflammation, swelling, or signs of infection, as that can be a sign of a problem. And I talked to you about lymphedema teaching. So lymphedema is what happens, like I mentioned, those lymph nodes that maybe are removed as a part of the surgery, they're going to be very sensitive. So any issue that happens, so let's say that I had a mastectomy on this left side, this whole arm is going to be at risk that if I get any injury to it, I don't have good drainage to my lymph nodes on this side because of that mastectomy. And so I'm going to be at higher risk. It can swell, there can be incredible swelling and definitely loss of function and things like that with the lymphedema. And so we want to be especially careful with this side. So usually they're going to have a limb precautions bracelet and they're going to do no blood pressures, venipunctures, injections, like no IVs, nothing done to that arm. We also want to encourage them not to hang that arm dependent for long periods of time and prevent any damage or trauma to that side. If they do have damage or trauma to that side, we need to promptly treat it and manage it. So if they got a cut, we want to treat it, clean it up, cover it, bandage it, and make sure we're doing really aggressive treatment of it. Really protect the skin. Now you might be saying, well, what if someone gets a bilateral mastectomy? Then a lot of times what we do is we do their blood pressures on their legs. What do you call it? They may get a different type of access, like they may have a port on their chest or something else, or some other sort of access. We may end up having to have an IV in their arm, but we really try to avoid sticking or doing anything to their arm that's going to cause trauma or damage. There's also cervical cancer. So the risk factors for cervical cancer are going to be having HPV, which is the human papillomavirus. There's immunosuppression, or having a higher risk of infection, whether because you have a condition or medications you're on. Using contraceptives long term can put you at risk for cervical cancer. Having multiple children, smoking, or being of Hispanic or African American descent. So the thing with cervical cancer is usually early on there's no symptoms, but as it gets later on, they might have some unusual discharge, bleeding, or the really late symptom is pain. Um, excuse me, they're diagnosed usually with the pap test. And usually most women start their pap test at age 21. That's the recommendation. They get it every 3 years. And then after every age 30, they get it every 5 years. And then also having regular HPV testing. And usually when they do pap testing, they're also testing for HPV. Like it's kind of like, think of, what do you call it, in a urinalysis. When they look at a urinalysis and think the patient might have a UTI, they look at the urinalysis. If there's anything abnormal, then they go and send it for a culture if they think there's anything growing there. And it's the same thing with the pap. If any of the cells come back abnormal, then they'll send that out for HPV testing. So, the general treatment and management is prevention. They do have a vaccine that is available for both males and females to help prevent cervical cancer. And it's usually starts, they start it very early, like when they're teenagers and things like that, to prevent HPV. Which can help to prevent cervical cancer. Then a lot of the regular treatment, surgery, chemotherapy, radiation, and targeted therapy can be used. So, last but not least, there's ovarian cancer, and risk factors for this are going to be family history, personal history of breast or colon cancer, women who have never been pregnant, being older, a high fat diet, having an early period or a late menopause. Again, that's that long period of time that you're exposed to those hormones, or being on hormone replacement therapy after you go through menopause. And things that help to prevent it are breastfeeding, multiple pregnancies, and using birth control for more than 5 years. So you can see how some of these can hurt you, like, ovarian cancer, it helps to be on birth control, whereas cervical cancer, if you're on it for a long time, it actually can hurt you. So that's definitely why these cancers are very tricky. And sometimes it's like one thing helps you and another thing hurts you. So the general sign and symptoms early on, the patient may have abdominal pain, bloating. They can have urinary urgency or frequency, difficulty eating or kind of that early satiety or feeling full really quickly. And then late on, they can have abdominal enlargement, ascites, unexplained weight loss or gain, and menstrual changes as well. We can diagnose if there's a tumor marker for ovarian cancer. That's the CA125 that we can test for. It's not necessarily like that. That may show other things as well, but it definitely is highly correlated with having ovarian cancer. A yearly pelvic exam and an abdominal or transvaginal ultrasound as well. Some patients that are very, very high risk for ovarian cancer can and will have prophylactic removal of their ovaries. That's known as an oophorectomy. They can also have, if they have or ovarian cancer, they can have surgery. And after surgery, I want to teach them to avoid heavy lifting, and that once those ovaries are removed, they go into what's called surgical menopause. So this goes for any of these patients. So, like if a patient that's really high risk for breast cancer gets their ovaries and everything removed, they're going to be very high risk for, this, not high risk, they're going to go through the surgical menopause. And so just teaching them kind of what that looks like, because most patients, menopause is very uncomfortable in general in anyone, but especially when it happens so quickly and there's that quick withdrawal of the hormones, it can really take on and get severe really quickly for these patients. So just helping them and teaching them how to manage that. Chemotherapy and radiation as a whole also, of course, are other treatment options for ovarian cancer. And as a whole for this patient, teaching them coping and therapeutic communication, managing their pain and symptoms, and then preventing all those complications that can occur. So those are female cancers. Hopefully this helped to kind of get you started in seeing different types of cancer, and I will see you in the next one.